So we've been advised that we should only see emergency or urgent care patients, and routine dentistry, whatever that means, to the press is something that we should avoid. So let's talk about that. So emergency care is obvious. Somebody's got an infection, somebody's in pain, somebody broke a tooth. They're calling us to come in because they need to be seen. This is something we've done in dentistry forever. Urgent care is a little bit more nebulous in its definition. We have to reach out to the patients that we have an active treatment and say, listen, we've started you, whether it's a crown, whether it's a bridge, whatever the case is, and you need to come back to us so we can finish you up. That is what urgent care is, because delaying that patient's treatment is putting that patient at harm. So let's review the two scenarios. Patients have an emergency, they call us. Patients who are in active treatment that we started before this whole COVID thing kind of changed all of our lives, those patients now to be reached out to and say, listen, the doctor started this procedure back in February or March or April, and you need to come back in so that we can finish that procedure. Now, there'll be some patients that are going to be like a little nervous. It's like, well, I thought, we're supposed to wait until June 15th or, 2021 or something like that. And it's going to be up to the office to explain why the care that that patient needs is considered urgent. Personally, I think that call needs to be made by the doctor, because if the front desk makes it, it's going to have a certain impact to the patient. But if the doctor gets on the phone and says, listen, I have your interest in mind, I have your health in mind. We started this dentistry back in February. We need to finish it. You're putting yourself at risk, and I cannot be responsible for that. I care too much about you, and our front office is going to make the appointment for you to finish up. Before you make the appointment, let's talk about some of the concerns you might have as a patient coming into the office, and I'd like to spend a few minutes explaining to you all the procedures and all the extra things that we've done above and beyond what we are normally doing to make sure that you're the absolute safest coming into the office. That conversation is going to do exactly what we want to do, which is to build the trust, patients understand the safety involved, and it's how you're going to be able to maintain your practice going forward. Without you doing that, a patient's imagination is not its friend. It's going to start to think all kinds of wild thoughts. But if you, along with your office team, reach out to these patients and just speak to them honestly and make sure there's no time limit to the conversation, you're going to get these patients back in for urgent care, and you're going to be able to keep them happy and healthy. One of the biggest questions that I've been asked, and probably the most often, is understanding the idea of staggering patients. So let's talk about some of the bigger offices that I've actually talked to where they've got more than one hygienist, where they have 3 hygienists. And they were kind of wondering, well, what do we do about that? So it's going to be a little inconvenient in the beginning, but I think what you're going to realize is that going forward, this is the best way for dental hygienists to try and stagger their patient flow. And it's going to help with the doctor's schedule as well. So let's imagine we have 3 dental hygienists. Hygienist 1 is going to see a patient at 8 o'clock, hygienist 2 is going to see a patient at 8:20, and hygienist 3 is going to see a patient at 8:40. This goes against everything that we learned about trying to schedule patients in a block type kind of thing, where all 3 hygienists would see a patient at 8 o'clock and all 3 hygienists would see a patient at 9 o'clock. That has to change now. So you're going to be seeing patients every 20 minutes in the hygiene department so that those patients start to become staggered out. Now, in the beginning, what I'm recommending, and I said this before, is that you need to add additional hygiene time because the patients are going to have a lot of questions and concerns, and we need to kind of get back into the routine of what we're doing, and that goes to the soft opening. So if you're normally seeing every hygiene patient every hour, you may want to make it an hour and 10 minutes or an hour and 20 minutes. As long as the staggering is consistent between the 3 hygienists that you have working for you, then it's all going to kind of flow throughout the day. So one of the hygienists is going to start at 8 o'clock and finish at 5 o'clock. And the hygienist that starts at 8:40 is going to finish at 5:40. And that's okay. Because really what you want to do is you want to make sure your patients feel safe and that they're happy about visiting their office because they know that you care about them. So that's how you're going to stagger hygiene. So one thing that was very popular and still is before you do an implant surgery or a periodontal surgery, And quite honestly, a lot of the general dental procedures is years ago they talked about a pre-treatment rinse, having the patients rinse with chlorhexidine before we worked on them. And the whole point of that was to try and kill the bacteria in their mouth using chlorhexidine. Great idea. So what are we going to use as a pre-treatment rinse going forward with the coronavirus? And there are some reports out there that if we have the patient rinse with a hydrogen peroxide rinse, something over the counter that you can buy at the drugstore, it's going to kill whatever coronavirus is inside the mouth. Now, I think it's a good idea. I think there needs to be a little bit more research on this, but it's not going to hurt anybody. So if it's not going to hurt anybody and potentially help, I think it's a great idea. So pre-treatment rinse with hydrogen peroxide, I'm in favor of it. Surface disinfectants, a little bit of confusion, a little bit of who do we want to believe, what are we reading, where do we want to go with this whole entire thing. Obviously, chlorine bleach is going to kill anything that's on the countertop. The problem with chlorine bleach is it's very caustic. It's going to start to corrode the metal connections on our equipment. So back in the olden days when I was seeing a lot of HIV and AIDS patients, we used to wipe everything down with chlorine. And after a month or two, you can start to see the effect that the chlorine had on all the equipment. It turns out that some of the more common sprays that we use, something like CaviCide or Lysol, according to the CaviCide bottle, kills the SARS virus. The SARS virus is a COVID virus. So we're going to make the extrapolation that if it kills one COVID virus, hopefully it's killing another COVID virus. And I believe that. So we also know from the news too that Lysol spray works as well. We can spray down countertops, we can spray down the chairs and everything with Lysol spray. And of course there's a lot of other sprays and chemicals out there that we can be using. But I think for the short term, what we've been using traditionally in dentistry is going to continue to work. We may want to add a little bit of Lysol spray to clean the air, which is always a nice thing to do anyhow, and to kind of spray off the countertops in addition to the surface disinfectants that we normally use. But I think this is kind of an evolving topic. I think more research needs to be done. From everything that I've read, the COVID virus is not that hardy. It's not like trying to kill a hepatitis virus. But I do know that a chemical like CaviCide and a lot of the other surface disinfectants kill hepatitis B. And that's a tough virus. So if it's killing hepatitis B, I like to make the assumption that it's killing the COVID virus as well. And I think we're going to be okay using the typical surface disinfectants that we've been using in our office all along. Many of the office designs that are out there now are an open bay kind of concept. The actual operatories are divided by cabinetry, but rarely does that cabinetry go all the way to the ceiling. So how do we keep our patients safe and how do we keep our office team safe when we've got a design in our office doesn't really allow for that? Well, the quick fix to that, before we decide to totally redesign our office and have individual operatories like we used to have, where it was a separate room and there was a separate door, is you can buy plastic. You can buy visqueen, the plastic that you can buy in Home Depot, and you can hang it from the ceiling, and it can be draped down in between the operatories, and it can touch just to the top of the cabinets, separating the two operatories or the two work areas that you're in. That visqueen now creates an artificial barrier between you, actually not an artificial barrier, a real barrier between you and the patient in the other operatory, which is, 10, 15 feet away. So for the short term, I recommend getting visqueen or plastic drops in between the cabinets in the back work area. One of the other questions we have is what should the front office do when patients are coming in and how do they interact with them and what should they be wearing and what kind of barriers there should be? Well, first of all, the patient really shouldn't have a lot to do interacting with the front desk. When the patient comes, they're going to call from their phone and they're going to wait out in the car, and then they're going to come in, and when they come in, they're not sitting in the reception area. They're going straight from the outside area. They're going to walk through the reception area. They're going to meet the dental assistants and have the person use some hand sanitizer to wipe their hands before they enter the office. The person's going to be walked right back to the treatment room, and they're going to have a seat. And if you use a pre-rinse, you're going to use it at that particular time. That patient doesn't really have a lot to do with the front desk at that particular point. If the patient needs to fill out some forms and you're not electronic, then the forms can be given from the front desk to the patient through the door. The patient goes back out to the car, fills out the forms, calls up the front desk when they're finished, and they bring them to the front office. What about checkout time? So a lot of offices routinely now will make the next appointment for the patient in the back, in the treatment area. If that's not your routine and the patient typically comes to the front and checks out, the best thing to do then is where the front checkout area is, put a table or chair so that that patient is at least 6 feet away from the person checking him out. And if the person's going to pay by credit card, the person receiving the credit card is going to have a wipe, and they're going to be wearing gloves. They're going to wipe it off, which is what we can do, and then they're going to run that person's credit card. For as silly as all of that seems, and is it really overkill, what I always say is, why take a chance? Let's go ahead and try and keep our staff as healthy as possible by doing all the barrier techniques that we can do, and the patients are going to appreciate that. So, are you going to get the virus from the credit card? I don't know, but let's go ahead and wipe it off before we run it. Let's keep the patient at least 6 feet away from us, and if we have to add additional tables or chairs in front of our checkout desk, then let's do that to make sure that we're keeping everybody safe. So what we've learned, and what I've learned by having all these questions brought to me from, I can't even tell you, hundreds and thousands of dentists throughout the entire country. It's been an amazing journey this past week. But what I've learned, and it goes back to the 3 rules that I've always thought about dentistry, is what's best for my patient. That's always rule number 1. And whether it's doing periodontal probings or doing oral cancer screenings, rule number 1 is always what's been best for my patient. And what's been best for my patient, especially in today's world, is to spend a little extra time communicating with my patient so they understand everything that we're trying to do to keep them safe. By doing that, rule number 2, is what's going to protect me from a liability situation. I don't want anybody suing me. One of the reasons I do periodontal probings, one of the reasons I take x-rays on a regular basis, one of the reasons I do oral cancer screening is to potentially prevent a lawsuit. By doing all the things that I'm supposed to be doing to keep my patients safe with the COVID virus out there, I'm preventing a potential lawsuit against me. And rule number 3, which is the most exciting rule, but not the most important rule, is if I follow the first 2 rules, I'm allowed to make money. So in the upcoming videos, we're going to talk about the economics of dentistry and some of the pitfalls and some of the challenges we have going forward. And what you're going to understand is that we're going to be okay. This is going to be okay. When you start to understand the economics of why that is, you'll be happy that you're still a dentist. A lot of frustration. I've heard so many frustrating things out there from dentists wondering, do they make the right decision? You have. So let's talk about that next.